Hello, this is Instituto Coluna Vertebral, is institution that works in the branch of musculoskeletal health, and we are accredited by Brazilian Society of Orthopedic and Traumatological Rehabilitation. We are an institution that are specialized in the diagnosis and the treatment of musculoskeletal disorders. Not only in the spine, but we work in the all musculoskeletal area, considering the conservative approach. Okay, that means that we don't perform surgery, and we do all the strategies possible for the patient to avoid surgery when it's possible, and also we focus on diminished medicine intake for the patients. And then we can say that our institution is specialized in the diagnosis and treatment also in musculoskeletal conservative area, and focus in a treatment that based on evidence, based on clinical values, and also bringing the all efforts to make a better and resolutive treatment for the patients. And we are based on in a city in the south of Brazil. It's in a very industrialized city called Novo Hamburgo. And after some decades, we start to work in the teaching area, educational area, for especially for physiotherapists in the several types of programs for physiotherapy post-graduation programs. And also, after some time, we start to raise a model of business that we can consider franchising. And now we are present in 12 cities in Brazil, and also one city in Italy, in the area of Tuscany. The city is Montecatini. Well, we are a group of specialized professionals in the musculoskeletal area. We focus on diagnosis and pain control based on the clinical and scientific evidence, treating all the musculoskeletal area, treating for shoulder, elbow, knees, hips, ankles, and all segments of the spine. We provide reports and expert assessment in all this area. And then the force, the power of the name is so great, Instituto Coluna Vertebral. And why the Instituto Coluna Vertebral if we don't work only with spine? Because we have strong roots. We are not only chiropractic institution, but we have strong roots in chiropractic. And these strong roots in chiropractic brought to us a strong philosophy, considering that the spine is the one of the most important organs for musculoskeletal syndrome and disorders also. And then this name brings a piece of the philosophy of chiropractic and the way to treat in a conservative way. Okay, the bigger aim is treat in a conservative aim, and also diminish the chemistry and a certain level, and diminish the surgery, but recognizing the evidence, and also recognizing the demand of the patients. Okay, now it's very important to consider that we are not like a only fan of conservative treatments. We do the best to do the conservative options on treatment, but we always will consider all the possibilities of treatment, including surgery if it's needed. Okay, but our focus is really conservative treatment. And then we are a group of specialists, all specialists in that area, musculoskeletal area. We have physicians, medical doctors. We have osteopath, chiropractors, physiotherapists specialized. Like this is the main professionals that coordinate the units of Instituto Coluna Vertebral. But we have also other type of professionals that we consider like assistants, and there is different level of assistance in this for this professional that work together with the coordinator of the clinic. And important to know that this is our identity, the musculoskeletal area, and focus mainly on spine, but not only in spine. And we have strong influence of many doctors around the world, and also we have consultants around the world, like countries like the United States, um, Italy, uh, Austria, United Kingdom, and we gather all the knowledge for the conservative procedures and diagnosis that we do in this institution. We brought all this knowledge to make the best for our patients and to bring all this influence for a leadership in the market here in Brazil. Okay, and do the best technology, the best knowledge, considering clinical and scientific evidence, attending for the needy, the demands of the patients. And then we also have a good, not exactly good, we have excellent uh, educational standards for our doctors. And these standards include strong specialization programs, and also international education patterns in the same countries I already talked. And then we have in the Brazil the best multimodal service. We are one of the first multimodal clinicals in Brazil and also in Italy, focus on the less surgery and less medication. And this multimodal approach is very interesting because we have a better preview of financial issues. Our costs is more previewed for the patient, and also is have a multiple interest because also is more easy to manage all the costs for with the doctors also, with all the strategy and protocol we have to develop these multimodal strategies. And then we have a differentiated and accredited units in specific subspecialty with the musculoskeletal area, considering all multimodal and conservative treatments, always non-surgical, focus on reducing the use of medicine, clinical and scientific evidence, group of professionals highly specialized in musculoskeletal health, but above all, we are passionate for our we do for our job, for taking care of the patients, and these work very well. And we have a very good credits from each community we belong, considering the unities we have. Then our differential is the special training and certification with the best team of clinicians and teachers on the national and international scene. Muscle techniques, reflex techniques, chiropractic techniques like Thompson, Gonstead, Logan protocols, and diversified techniques, specialized sports chiropractic center and protocols also. And very important, we have very important concern, very big concern in security protocols. The Instituto Coluna Vertebral have a lot of security protocols that we consider to accept the treatments of any type of patients. And first of all, we have to focus on security. Okay, and then Instituto Coluna Vertebral. Okay, that is a very interesting image that focus on our identity, like musculoskeletal health. This is all in Portuguese, and we have here in Novo Hamburgo. This is a folder of Novo Hamburgo institution. We have in Novo Hamburgo is New Hamburg City, Novo Hamburgo city in Brazil, in the south of Brazil. It's a German city, German colony, German settlement. And we have two unities here. It's the Unity 1 and Unity 2. One is more focused on diagnosis and also acute crisis and the acute phase of the patient. And the second is more focused on the rehabilitation and correction and rehabilitation and also maintenance for the patient, that patient that need. And then we work in different phases with the patient, and we have different strategies. And this institution here in Brazil, this unity is the Unity 1. We have the more complete standards and the strategies of treatment, and also the certifications. Is the more complete unity that we work in the rehabilitation, traumato-orthopedic rehabilitation. I mean, and the ICV discal hernia also division we have here is a service specialized in the treatment of degenerative discal disorder and also discal hernia. We have a nucleo focus on the acupuncture, dry needling, and pain control with less medicine. We can also prescribe some medicine here, but we do it in few cases, and we focus more in the non-medicine therapies and also non-surgical therapies. And we bring a very strong strategies to make solution of the case and treat the cause of the patients. Okay, that is the aim of Instituto Convertebral, and that is the how this is the scenery of Instituto Convertebral in Novo Hamburgo. And we have also some illustrations showing about the chiropractic treatment, about the physiotherapy, advanced physiotherapist treatment, and also decompression treatment. It's all written in Portuguese. But we have also the certification of orthohol is a chiropractic, something like a Brazilian chiropractic biophysics, is biomecânica clínica, is the same methodologies of chiropractic, but it's a Brazilian brand of it. And we have a sport division also. We have a constant division and also instrumental division for chiropractic, and also the Thompson. And the Thompson is our division in Thompson is certified by Thompson Terminal Point Technique from John Minardi, and represented by the coordinator of the chiropractic. This is Dr. Pablo Diaz. Okay, and then we have also standard service methodology that is illustrate patients, guidance materials, specific training, and this methodology help to educate the patients, have to easily make adhesion for the to the patient to the for the treatment, to make the patient more interested and interested to keep all the instruction we give to him and understanding what is happening. And we have a methodology about this, and this is very important because the patient must be part of the treatment, okay, and not only conducted by the doctors but also making part of all this treatment. We have also an app of ICV to appointments, reports, tips for patients. Also, we have we are focused on diagnosis, treatment, prevention, and the primary, secondary, tertiary level rehabilitation, conservative treatment, reduction in the use of medicine. That is our focus here. And we are also do continuous training, and the education is very continuous here. And our mission is promote a positive impact on the community, contribute to well-being, quality of life, prevention and promotion of musculoskeletal health. We want to act as a reference in musculoskeletal care for patients and professionals. And we have many units like that one in the Erechim city. Erechim is in the Rio Grande do Sul city, also very industrialized city in Brazil. And is coordinated by Neymar Borg. And our differential is the delivery of care in a multimodal therapy based on clinical and scientific evidence integrating professionals, technique, and subspecialty. Development of strategies to treat the specific cause of patient's problem. Development of treatment plans is very important. We have individual treatments also, visits, but also we have modality of treatment plan, treatment assistance plan, and guidance and health education for prevention. Okay, this is very important. Differential that we have, that we offer to the community we belong. Okay, and then we have here in this slide we have the Dr. Remo, Dr. Rafaela Donin, Dr. Remo from Italy, Rafaela Donin, and Dr. Neymar. One Remo, how you see, is from Italy, and is osteopath. He's physiotherapist and osteopath, and Rafaela Donin is physiotherapist like Neymar Borg also. Okay, and in which we can show to the patients that we have programmed and established methodology to how we develop in the field of practice, clinical practice, have a well-studied strategy. And this strategy means that we can classify the patient, we can diagnose the situation, and divide the treatment with special phases, like phase 1, control, pain control and inflammation, also decompression. Phase 2, biomechanical correction, and phase 3, muscle rebalance. Okay, and the fourth phase should be therapeutic maintenance when is needed, especially for that very chronic patients, and also that elders that have some degenerative change that need the maintenance approach. Okay, but it's not only a board like this. Inside of this board, we have divisions, we have methodology, we have, for example, phase 1 ABC, phase 2 ABC, phase 3 ABC, with several strategies that already are developed that we can change according with the need to the patient. All well thought to develop the better strategy based on the better evidence disposal, and also to have the more resolutive possible treatment. Okay, that is our strategy. And then Instituto Columna Vertebral, yeah, there's two possibility for Unity. We have a headquarters commercial complex, like inside of the building, like inside of a building Unity is a small Unity, and also we have external ground floor headquarters. Okay, it's two possibility. Okay, so we can start in a city with a small Unity and then make it grow up. And this is the commercial room in the building. This is a 60 to 80 square meters. Okay, it's not so big. It's very functional, direct, and also profitable. Okay, and this small unity is have a waiting room. Need to have a waiting room, counter and desk space, 3 rooms for service. In general, it's one office, manual therapy service, and electro and dry needling room also. The capacity per hour is 3 patients. Okay, we have a possibility to attend 3 patients per hour. Okay, and then this is the appearance of Instituto Vertebral in the external unity. Okay, and we pre-approvate the fachada. Okay, and there is also a possibility for that one in Erechim that we have in Erechim. And here is the waiting room. It's not so difficult to mount this waiting room. This is a simple example of waiting room, and we have a TV on it. We have at minimum 4 or 5 seats for the patients. Okay, and we have a TV always showing explaining about our service and some product that we have to offer according with the need to the patient. Okay, the waiting room must be planned with the aim of promoting comfort and hospitality for patients. It must be designed to accommodate patients and companions. Okay, at least four seats for the waiting room, considering that we have 3 patients per hour. Okay, this is one example. Is Santa Maria City. This is an example of service room. Santa Maria is very beautiful room here in Santa Maria City. This is also Curitiba. Is the example of the service room in Curitiba. The waiting room should facilitate the patient's education process with videos, animations, and illustrations. Education and illustration based on laminated charts and maps on herniated disc, osteoporosis, therapeutic maintenance, and the service and the products and others. Okay, and also there will be charts showing the plan of treatment. They explaining to the patient the plan of treatments. This is very important. All the time the patient must be educated to everything is happening or will happen with them in the next month of treatment. Okay, and then this is an example of advertising. We have online advertising, so groups and social media. The customer's own agenda is very important to do some advertising because the attention of the assistant, the secretary on the agenda also will be a tool to make more clients. Okay, not only the proper clients but the others, the contacts of these clients, based on the information and education. Okay, very important. Printed folders and flyers and other advertising media. We also have impulsionation. We can also impulse and boost, understand, on the Facebook and Google ads and something like that. And we have standardizing of protocol with quick guides, okay, to help it and to prescription, how the coordinator can prescribe the techniques easily for there will be all the time the main treatment and the secondary treatment. Okay, and this is very easy to establish a pattern because we have our standardization of protocols with quick guides. Okay, and then of course this is a illustration of the area. Okay, this is not the uniform. We have another type of uniform to let you know, but this is example of the area here in the office, for example, and here in waiting room, and this is in the front of the center room in inside the center. Okay, clinical center. This is another unit based of maintenance. Is more simple and focus on exercise and also hernia. We have the best technology, cutting edge of technology in the evidence-based conservative multimodal treatment, decompression, pain and inflammation control, treatment of acute and chronic pain, treatment of non-inflammatory pain, treatment of cause based on biomechanical correction. Okay, and then we bring the best clinical management. Our units are focused on objectivity and changing points, turning points. All we need to, if something is not going well with the patient, we need to we have protocols considering the time, considering the changing of procedures and protocols to attend the needs of and the phases of treatment, the needs of the phases of treatment. Okay, considering that we must preserve the pain, preserve the patient from the pain. Okay, it's very important, and all is based on clinical management. Okay, this is an example of clinical care rooms and internal access in the outpatient format, considering security and privacy in the patient allocation in an outpatient setting. Internal access with professional privacy for discussion of clinical cases also. Okay, minimal clinical unity staff. And the minimum clinical unity staff is 2 person. Okay, this is the minimum team of a unity. Only two persons, one technical coordinator and one assistant. However, the numbers of employees may vary according to the scope of clinical practice and physical size of the clinical unity. Okay, then the number of staff will depend on the size and the how can I say the how many procedures we have in the clinic. Okay, and then more staff, more procedure. Okay, or the opposite: more procedure, more staff, and more money also. Of course, there is we have to make a very good financial balance all the way, and we are here to help about these things. Considering in any different city will be a slightly different reality, even considering the same country. Well, and the clinical professionals, the coordinator, maybe chiropractor, osteopath, specialized physiotherapists, and physiatrists. This depends on the law in the country. Okay, but we consider that these professionals can be clinical coordinators, but also we have to consider the regulation of the country, local regulations. And then outpatient assistant, we have assistant one, is a basic training. It's not the person that do clinical procedures. It's a secretary more trained to do some help and understand how to talk with the patient better and how to localize the things and organize the things inside the infirmary. And assistant two is a massage therapist or academic in the field, or maybe nurse, technique in nurse, technique in physiotherapy. And this assistant two is like something, some people that can help you in the clinical field by prescription. And the assistant three is a graduate professional adjunct in the health that is like an assistant more qualified to the coordinator profession. And all these we have a certification and training. Even for the first level, we have training, and also for the higher level, the assistant three, two, and three, we have also a continuous education program. Okay, discussion. And there is 7 possibilities of unities. We have the level 1 is musculoskeletal rehabilitation, stomatologic and orthopedic rehabilitation. This includes orthopedic manual therapy. This is the level 1. This is the linked and approved by Brazilian Society of Orthopedic and Traumatologic Rehabilitation. The level 2 is specialized unity for the treatment of herniated disc, is ICV discal hernia, ICV hernia. The level 3 is specialized in chiropractic unit. Level 4 is specialized in osteopath unity. Level 5 is specialized unity in sport area. Level 6, therapeutic maintenance. Level 7 is a mixed unity. And any unity maybe more than one type, okay? Depending on the degree of the professionals there, the coordinators, depending on the professional of the coordination, the laurea of the degree of of the coordination or laurea, okay, the specialization course that this coordinator have. Sometimes we have unities with much more than one specialty, okay, including therapeutic maintenance. For example, depend on the area of the clinic, depend on the equipments, and depending also the curricula of the coordinators and the professionals. Okay, and then adoption. The unities develop specialties based on the needs of the local community and the expertise of the professionals, always seeking to offer the best service. Okay, this is the principle of adoption that we ICV clinics have. We also have special certifications for ICV. That some clinics are more specialized in some areas. For example, this unity is specialized in ICV chiropractic, is specialized in chiropractic, sport chiropractic, and orthopedic and traumatological rehabilitation. Okay, then have these two like SEALs certifications. Okay, and these also we have different types of certification like instrumental adjusting therapy. That when we have a coordinator that have more ability and more proficiency in some area, we have special certification for it. Okay, and that ICV is the best that we can do that area, considering the law of the country. We have different possibilities, and we can substitute some techniques when it's not possible to do that technique in some country. Okay, we can here in Brazil is the base on is the law of Brazil. We have a forwarding of exams, reports and expertise, clinical managements, several strategies here in orthopedics. And in chiropractic, we seek to have the better chiropractic. We seek to have different methods and techniques, and we can do the best efforts to have the best formation and continuous education in chiropractic. This is very important. Okay, and we have many services, including traumatorthopedic, chiropractic, orthopedic, manual therapy, acupuncture, needling, postural adjusting, ortho clinical and biomechanics like biophysics, chiropractic biophysics, um, like instrumental chiropractic, neurodynamics, somatovisceral techniques, and sacrooccipital techniques, also flexion destruction, myofascial release, shiatsu, and others. Okay, and we also have the hernia with a cox table and flexion destruction, with many protocols on it. We have different combined techniques in the flexion destruction that belong to our protocols. Okay, and this combined effects like this compression with association of other techniques we have like technological techniques and also electrotherapy techniques, and also all these set of abilities and technologies bring better outcome is the principle of multimodal approach. Okay, and this is means that profitability, security, and resolution. That's what we want with advanced electrotherapy, with manual therapy. Okay, several technologies and also techniques with the better prescription, with a standardized form, regulated prescription models, requests for standardized exams, partnerships for discounts and patient facilitations, and the better chiropractic technique ever. Okay, is one of our main principles is that chiropractic approach. Okay, is very important, and to have this, we build also our philosophy on it in chiropractic. Okay, and that's is a very good investing, and then I hope you like it. Considering that we have many brands and formations for the doctors that belong to ICV, and we are dedicated to the formation, to bring formation for these doctors, to bring excellence of these doctors in many patterns of qualification. Not only have a specialty title of graduation, laurea, something like that, but have a special proficiency, and means to that society, to that community that we have something stronger. And together with that, the best technology, and also um, designed products, especially for the unities that can attend and complement the treatments. We are focused on it also. Okay, uh, that's right. I guess it's enough. We can talk about more about the financial issues.